In 1961, President Kennedy called on all Americans to rise to the challenges of the day. He knew that success depended upon the unity of efforts throughout the federal government and the nation. The Greater Boston Federal Executive Board, one of 28 across the country, fosters communication, coordination, and collaboration with federal, state, and local government agencies. This is your federal government, and I am your host, Diane LeBlanc. Hello, everyone. Today we are featuring the Administration on Aging, which is part of the Department of Health and Human Services Administration for Community Living. Our guests today are Regional Administrator Kathleen Otte and Regional Nutritionist Joseph Carlin. Welcome.
Well,
Thank you, Diane.
Thank you for being here.
Pleasure to be here.
Kathleen, I'm going to turn to you first.
Sure.
Tell folks about the history of the Administration on Aging, how and why you came into being.
Well, the Older Americans Act, which is actually the enabling legislation for the Administration on Aging, was enacted in 1965, and some of us still remember that day and time. But it was a time of great interest. The war on poverty was certainly something that people were thinking about, and also the Great Society legislation for President Johnson. So in 1965, the Older Americans Act was passed, and interesting enough, it was passed before Medicare and before Medicaid. But it provided older people, and older people were defined as 60 years of age, that they had certain assurances that the Older Americans Act would provide for them. And today, as we sit in 2013, we know that these assurances have held true the test of time.
Okay, so your placement is within the Department of Health and Human Services. Yes. And part of the Administration for Community Living. Just talk a little bit about that.
Certainly. The Administration for Community Living actually has celebrated its one-year anniversary. It brought together the disability population with that of older Americans. So we became a new administration for community living 12 months ago, but we still have the Older Americans Act, which we do provide services for and monitor quite closely.
Okay, and today our focus is going to
Correct.
be on the Administration on Aging, which is still a business line. How do you?
Yes, it is. Well, the Older Americans Act is our enabling legislation, and again, for seniors, we have services that we provide under that legislation. The disability population has the ADA, the Americans with Disability Act, and they have that legislation that they work under. But as you made mention today, we're going to talk about seniors and senior programming.
Excellent. So you are the regional administrator for Regions 1,
Yes.
Region 2,
Yes.
and Region 3. Now, I served as a regional administrator for many years, and I, at one point, I had Region 1 and Region 2, but to have 3 regions,
It's challenging.
what is your geographic area of responsibility?
Well, I'm very proud to represent New England, which is Region 1, of course, and we have 6 states in Region 1. Region 2, we have the Virgin Islands and Puerto Rico, as well as New Jersey and, of course, New York. And then we pick up the lower quadrant, which goes all the way to West Virginia, D.C., Delaware, and Maryland. So it's a great opportunity because, quite frankly, as we look at senior programming, many of the innovative practices begin right in these 3 regions. So I'm very proud and busy, but to be involved with the regions, it's just great.
And within the Department of Health and Human Services Administration for Community of Living, how many regional administrators are there?
Yes, well, there are 10 regions throughout the United States, but there are 5 regional administrators.
Anybody else have 3?
Nope, just us.
Okay.
Just us. We're special.
All right. So that's quite a geographic area of
Yes.
responsibility. Again, most of our viewers are from Massachusetts or New England, but we do have actually viewers across the country. So where are your offices located?
Well, we actually have 3, and we have them in the regions. The Region 1 is Boston office at the JFK Federal Building. New York is our Region 2 office, and Region 3 is Philadelphia. So we just can go up and down the train and meet all 3, but those are the offices that house our employees that serve the Older Americans Act programming.
Okay. How many employees are you responsible for?
We have seven, and 7 employees that comprise Joe Carlin, our nutritionist. In fact, we're very blessed because we have the only nutritionist in our regions, which is Joe Carlin. Also, we have a financial specialist, and then we have aging specialists that work with our states, our state government, to help bring those programs to the states, the Older Americans Act programming.
Okay, so we're going to come back to some of the partnership with the state. And Joe, you're the regional nutritionist. What does that mean? What is a day like for you?
What does it mean, being the regional nutritionist? Well, I'm sort of the technical expert, not only on how to plan good menus, but also on food safety, food service delivery systems, new products that are coming on the market. And my primary responsibility is to work with each of the 16 state nutritionists in our tri-regional area, keeping them up to date on changes in the Older Americans Act, and also tracking the data that they report to the federal government. Sometimes that can be overwhelming and confusing, but also to field a lot of technical questions that we get from the states, and to help them run better programs.
Okay.
As a matter of fact, before I came to the studio this morning, I had an email from our employee down in Philadelphia, and she wanted my comments on some developments in the state of Delaware. So I quickly responded to that.
So Joe mentioned 16 states, and you said 7 employees?
That's correct.
For all 3
For all regions.
regions.
Yes.
So there are 7 federal employees who work for the Administration on Aging. This, what seems to be a pretty awesome responsibility of taking care of our seniors, and we're going to talk about some of the more specific things that you do.
Indeed.
Wow. So you're traveling an awful lot, I know, back and forth.
Yes.
But Joe, do you have to travel?
I don't travel as much as I used to. You know, the internet has made this possible to hold a conversation with anybody in moments. And we have wonderful scanning facilities where we can send documents off in a moment.
Absolutely. The technology really has allowed us to do our jobs more efficiently and to communicate with, you know, our colleagues and our counterparts across the country. Although I don't think you have a counterpart.
No, I don't. As a matter of fact, I don't have a counterpart in the whole country.
So is it just our 16 states in regions 1, 2, and 3 that are lucky enough, or do you sometimes get called upon to help out elsewhere?
I do get calls occasionally to field a question out in Wisconsin or so forth. But we do have 2 nutritionists in our Washington, D.C. office that can fill in all the gaps. But they're tracking all those major policy issues and writing rules and regulations.
So Kathleen, you said that the Older Americans Act provides assurances for our senior population.
Yes.
What kind of assurances?
Well, assurances that are most important. Certainly, even back in 1965, we recognized how important it was to have mental health, strong mental health and physical health, and make sure that that's part of someone's lifestyle as they age. Also, the ability to have community structure, to have organizations in the community that can meet the needs of seniors. Thirdly, socialization, you know, and isolation are such really challenging issues for seniors. And the assurances made sure that people had places to go where they could socialize and come together on a frequent basis, and certainly, as you know, the nutrition as well. And then also self-direction. Even back in 1965, the ability to have your own decision-making was of utmost importance. So those are some of the basic assurances that we see in the Older Americans Act that are just as relevant today as they were back in 1965.
So that original legislation, as you said, the Johnson administration back in 1965, but things have changed since then. So I'm guessing that there have been legislative updates. What are the key updates to that legislation?
Well, and Joe can add to what I'm going to say, because a lot of the changes have occurred in our nutrition programming because, again, we see seniors really much more active than they used to be, and they're going to senior centers. But some of the changes that occurred, the Older Americans Act is reauthorized every 6 years. We haven't been reauthorized lately. In fact, it's been it's going through Congress as we speak. But some of the major things that occurred in 2006 was more flexibility for states to shift some of the dollars that they have. If they had more money in a congregate meal program than a home-delivered meal program, there was some flexibility that was discussed at that time. Also, I think transportation, another issue that has come forward and has been a predominant part of the 2006 revision.
So you talked about some of the changes allowing states greater flexibility.
Yes.
The funding for all of these programs, does it start at the federal level and
Yes.
flow from the federal government to the states, down to the local communities? How does
certainly
how does
does.
that money happen?
Well, I'll begin, and then Joe can kind of fill in the blanks as it relates to some of our feeding programs, our nutrition programs. But indeed, the federal dollars are passed. It goes through our offices to make sure that, of course, the appropriate grants are going to the states. From the states, they either contract with in Massachusetts, we have ASAPs, Aging Specialty Points, and others like congregate meal sites. It could be senior centers, things along those lines. So it begins at the federal government, goes to the state gives it to the Aging Network, which of course, as I said, is our AAAs, ASAPs, and even local providers. And again, some of the most important people that receive the funding are the nutrition sites, because this is a place where people come together, either in congregate meal settings or in, of course, home-delivered meals.
So for most of the grant programs, again, where the money flows from the federal government to the state, to the local communities, it starts with the allocation being based upon the most recent federal census. And in our case, we've had the 2010 census. Is that how it's working?
That's absolutely correct. For the Older Americans Act programming, all of the grants are formulated and based on each state's population, and also their breakout of minorities and those people who live in rural settings. The formulas can be very different from state to state. But what is required from our state governments is that every 3 years they actually provide what's called a state plan. It's on every website for state government, and it talks about how they're going to utilize Older Americans Act programming dollars to serve older people living in their state.
So, I guess a question for the both of you. In New England, here in Massachusetts, what types of services, specific services, would we recognize as having stemmed from the Older Americans Act?
Well, I think the most visible service that literally all Americans are aware of are our home-delivered meals. It's hard to imagine that at one time we did not have home-delivered meals in this country. And that started in 1954 in Philadelphia, when a group of women got together and said that they would start providing meals to neighbors. And President Johnson actually knew about that program and funded a couple demonstrations in the 1960s to see if the federal government had a potential role in doing that. He thought that the federal government should get involved. And in 1971, legislation was proposed that the federal government be involved at a modest rate of just $100 million, providing home-delivered meals for the elderly, and also something very unique, congregate meals, a place where older people could go, sit down, meet friends, have a leisurely lunch, and learn about other programs in the community, pick up helpful information about controlling their diabetes or cardiovascular disease. And it's still a very popular program today.
Any sense of how many older Americans are fed through this program, either nationwide in your three regions or even here in New England and Massachusetts?
It's astonishing when we tell people that every year we're providing about 240 million meals. This is a significant food service operation.
Of course.
I like to remind people that we have more noontime meals programs in operation than McDonald's has hamburger stands.
Oh,
So they're literally
Quite
located
an
in
analogy.
every community.
yeah, and even locally in Massachusetts, we serve almost 50,000 people with home delivered meals. So the numbers are considerable when you stop to take a look.
And clearly the need
Yes.
is there, and it's a critical need.
The need is there, and the need has been going up as the population of people 60 and older grow.
So in terms of that particular program, if there's somebody watching that isn't currently getting, this Meals on Wheels, or currently participating in sort of the community experience of going to their senior center and getting a meal, but they want to know if they qualify, what do you suggest to them?
Joe, would you
Well,
like to?
the first thing I would recommend someone do is pick up their local newspaper, because those congregate nutrition programs are probably listed, and they'll probably find a menu for the next week in that same newspaper. If they don't see anything, call town hall. Also, look in the telephone book for a council on aging or under senior citizen listing. There might be a senior center in the town. Or go on the internet and Google their community, either the county or the town they live in, and something will pop up immediately.
And so many of those programs for our seniors are actually run through just the wonderful volunteers
Absolutely.
who work with their local community, Council on Aging, senior centers to go and pick up the meals and then to distribute them across the community.
Absolutely.
Yeah.
We would not be able to have home delivered meals in this country without volunteers.
I think that's exactly right. And nationwide, we have over 500,000 volunteers that help support the Older Americans Act programming. Many times it's that welcoming visit when someone opens the door and someone's
Right.
bringing in. It's a wellness check as well. Certainly they're there to bring the meal, but it also is somebody to talk to, someone to maybe just check on that senior to make sure they're well. So family members could also call those same areas that Joe made mention
Yes.
of to see what is available in the community for their parent or
in
grandparent.
their community. So that's one that is, as Joe said, most, I think, of our viewers will recognize. But what about other programs that are sort of under your area that it might not be so recognizable?
Certainly. Well, I'll begin by just saying we do have various titles under the Older Americans Act. We've been speaking primarily about Title III, but we also have Title VI, which serves our Native Americans. Also, we have elder rights issues under Title VII. The ombudsmans that visit nursing facilities are through the Older Americans Act, Title VII. As well as fraud and abuse. Many people who are senior Medicare patrol members, that means they help identify fraud and turn it in where needed so that we can really use our federal dollars effectively. Another thing I would say is, of course, elder abuse, which we know is on the rise in all states, and that's one of the things that the Older Americans Act does. It really encourages states to take a look at their statistics and to provide programs and adult protective services to meet the needs of those seniors they're serving. Very important information.
Absolutely, and all of those areas that you just
Yes.
stated very briefly, such critical areas. So you indicated that your administration has a role in going out to nursing homes and what, inspecting them? What do you do when you go to nursing homes?
Well, under Title VII, there are three opportunities. One, of course, is our ombudsman program. The other is just making sure that legal services, legal assistance is available to seniors. And the third, as I make mention, is our Senior Medicare Patrol program. But indeed, what we want to do is to make sure that seniors know that the ombudsmen are there for those people who choose to live in a nursing facility or an assisted living facility, that they have an advocate. And the ombudsman is that person. There's one assigned to each one in our New England states, to any nursing home in our New England states. And they are there to serve the senior, the client. They're not there to represent the interest of family. They're there for the seniors to be an advocate for their voice.
So we've talked about sort of the partnership between the federal government, the state government, and the local governments. What about other federal agencies that also serve the senior population? What are the key agencies that you're working with on a regular basis, and what do those partnerships look like?
Well, I'll begin. One of the programs that we've really worked very hard with CMS, the Centers for Medicare and Medicaid Services, we've been partnering with them to offer opportunities for our states to have care transition grants. That means that the funder is CMS, but we know our senior population well. So together we come together, devise a grant opportunity where people can transition from the hospital setting back home with seamless programming. So that's been a very effective program that the seniors enjoy as a partnership between CMS and our Administration on Aging. Another thing to make mention of is our Veterans Program. We have a Veterans Program that we work with the VA, the Veterans Administration, to encourage veterans to be able to go back home if they've been hospitalized or have the ability to provide their care, get their care provided at home. Those are two opportunities that have been very successful programs for a joint venture with our federal partners.
Right. There's probably no federal agency that we don't partner with at some point or to some degree. And talking about food, for instance, we work with the Department of Agriculture frequently. They're the primary source of nutrition information in this country. One of the other services that we provide on a daily basis, nutrition education, counseling, and we look to the Department of Agriculture for their standards that they set through the U.S. Dietary Guidelines. We also work with the National Academy of Sciences in setting the standards for the nutrient content of the meals that we serve. They all have to meet a very stringent 1/3 of the dietary reference index set by the National Academy of Sciences. And we work with the Food and Drug Administration, the Center for Disease Control, because we're constantly carrying out health promotion activities, trying to reduce the number of falls in this country. And we look to these other agencies like the Food and Drug Administration, the Center for Disease Control, for the technical support to do that.
Even disasters. We work very closely representing interests of seniors whenever we have any kind of catastrophe, any natural disaster or emergency. So we partner with anyone to make sure that the senior interests are well represented.
So what's your biggest challenge?
Well, our budget has been somewhat stagnant.
Probably I should have said other than
budget.
But
the increased need. I mean, certainly, I think it's a balance. Many of our communities are seeing more of an increased need. We see people who are choosing to remain at home and they need services. So some of our agencies, unfortunately, have wait lists. And so that's a challenge because they have a certain number of dollars to be able to provide the meals. However, they are the most innovative network, I think, around, and they do their great job of making sure that they can minimize that wait list and make sure that seniors have something to eat.
Right. Obviously, money and having more money available to the programs to expand their services would be welcome. But one of the things that I've witnessed over the past couple of years, because of that stress on money, our grantees have become very creative in raising money.
Yes, they have.
And making do with less, becoming more aggressive in recruiting volunteers. And volunteers have also come to forward. And they know the pressure that's on the program and have made extra commitments.
Well, and I think they they clearly recognize how important this program is to our seniors across the country. And, you know, the fact that they have those connections, as you said earlier, it's more than just a meal.
It is.
It's the connection that's being made. It's a wellness check. It's making sure that, you know, the mail isn't piling up, and is that person okay?
Friendships develop so easily.
You know, the Congregate Nutrition Program, where people come together at noontime, we constantly promote socialization, and we recognized at a very early date that this was one of the targets of our program. And evidence has borne us out in research that next to cigarette smoking, socialization, or the lack of it, is the next largest predictor of mortality and morbidity. People who socialize live longer. They're healthier.
makes sense. Yeah. So I live in Waltham. I
Yes.
work in Waltham, and here in Waltham, we have just a wonderful senior center, and our Council on Aging does all of those things that you just
Yes.
talked about. They are very creative, and the
Yes.
volunteers are wonderful, and it just it really works for the community. It is certainly a concern when you say that there are people on a wait list,
It is a concern.
that there are people who sort of have a need. Most people don't ask for somebody to deliver a meal if they don't need a meal.
That's right.
So you just need to continue to be
Absolutely.
thinking about how to do things better. You know, the reality is that budgets are shrinking,
Yes.
and you know, they don't always get cut, and you know, maybe where we would like them to be cut. But I think most people would agree that we shouldn't be cutting at the expense of our seniors.
Well, I think it's something for everyone to be aware of, whether you're a senior or if you're a caregiver or if you're a senior in aging. You know, many of the folks that we talk with, we even like to speak with people who are in their 30s and 40s because we say to you, you are a senior in training. So please take care of yourself and eat right and exercise so that you can live a healthy, happy lifestyle as you grow older.
Absolutely. Okay, so Joe, how long have you worked for this agency?
Oh, much too long.
No.
I actually got involved back in the 1970s when I came back from Southeast Asia, and I took the GI Bill and went to UMass and became a food technologist specializing in nutrition and the aged, and then became a registered dietitian. And lo and behold, I was hired to help set up the elderly nutrition program in 1973. Wow. So I had the East Coast, regions 1 and 2, and I would train newly hired state and local directors of nutrition programs how to operate these programs.
So you've been there since the beginning. What's the single biggest change that you've seen?
The single biggest change. Ooh, that's tough. You know, I've never been confronted with that question, but I'll tell you, I think the menu has changed.
Okay.
Older people back in the 1970s lacked dentures. We have fewer of those problems today.
Okay.
So you will find much more chicken on the bone on the menu today, and back in the 70s, there was a lot of meatloaf on the menu and mashed potatoes.
Right.
So that's one of the changes. But back in the 1970s, it was against the law, for instance, to serve anything other than a hot meal. And it took 4 years before Congress amended that to permit us to serve cold lunches. So we have seen an explosion in menu flexibility across the country with picnic-type meals, soup and sandwich, and even frozen meals that can be rethermalized.
Because of course many of the seniors, when they have that meal delivered, they're not necessarily eating it right
Absolutely.
then and there.
And that has also become a way for us to control cost in the program.
Of course.
By dropping off maybe 5 frozen meals, and then the older person can warm them up at their convenience. If they can't, then we will give them 5 hot meal delivery.
Right. But it's always nice to have flexibility. It's, you know, the old saying, one size does not fit all.
Absolutely.
So it really is nice to be able to work with whatever the needs are of an individual person. Now, how about you, Kathleen?
Well, much as Joe, but certainly not to the extreme level that he did early on in his career. But I actually volunteered at a nutrition site in Winfield, Kansas, many, many years ago in the 70s. Loved what I saw. Knew that I wanted to go into geriatrics, but at that point in time, there really weren't even a lot of geriatric programs. But the long and the short of it was I continued to do volunteer work. I went on to be a nursing home administrator and then was the New Hampshire Bureau of Elderly and Adult Services Director for 4 years. That's how I made my state transition to federal, having implemented many of these programs. So it's been a long process, but it's a very gratifying program to work with.
I can sense that, and I can also sense that you both, not only are you committed, you just really love what you do.
We do.
Absolutely. This is one of the few jobs, I think, in the federal government, you go home and you sleep good at night.
That's right. Because you're tired.
That too.
Well, especially you running back and forth to 16 states and 3 different regions. So thank you for
That's my pleasure.
For what you do. So, we've covered an awful lot of ground.
Yes.
We've talked about the enabling legislation and some of the changes and the variety of programs that you're responsible for managing with only 7 people, 3 regions, 16 states. What haven't I asked you? What is it that you think, our viewers must know?
Well, I'll begin by thinking about our programs that we offer in our senior centers called chronic disease self-management programs. These are bone builders. People may recognize them as the name of the program. Maybe diabetes control programs. They're all Stanford-based, meaning that they've gone through the evidentiary review process and they know that if you follow this program for about a 6-week period of time, you will actually learn about your disease process and you will be healthier for it. So we have those and offer chronic disease self-management programs in our senior centers. So that's something I would urge everyone to think about is if you haven't become involved in a senior center, please do. You will immediately become part of the group and really find it so enjoyable.
So that particular program, that information, you connect with your senior center. Is that going to be a class that's offered? Is that information that's online? Do they show up and they're handed a brochure and they say, read this and follow this? What does that look like?
We encourage people to be part of the program. There are special trainers that are there that monitor the progress of everyone. And it's a commitment. Usually it's a 6-week commitment where it's based not only on education about the disease process, but also about their lifestyle choices and gives them positive enforcement about how they can really make some changes that will see demonstrative effects just in a short period of time. Bone builders is another one. Women, as you know, have osteoporosis, and we can show through evidence and certainly through science that if women will use small weights and exercise on a regular basis, that they can actually increase. I know, me too. But I would think, even some of our younger viewers that are watching, I think it's never too early to start these great things.
Well, and I know with my own mom, she's 87 years old and she lives with me. I am just so very blessed to have her. But she's had some hospital stays and she's had some rehab stays. And sort of when you lose that muscle mass, it really has an impact. And they always send her home saying, even if you're sitting in your chair, use your weights, and it makes such a difference.
It's a big difference.
Yeah,
it is
really
a big
makes such
difference.
Joe, what would you like to add?
I think one of the things our program is doing is keeping people at home and not in a nursing home or premature institutionalization of any kind. It's what I like to characterize as preventing homelessness. Keep people in their home as long as you can. And I think meals does that.
Yes, it does.
And I think that is a key point, and this time has gone by so quickly.
Yes,
I think that's a good note to end on.
Very good.
There we go. So I want to thank Regional Administrator Otte and Regional Nutritionist Carlin for being with us today and for helping us to better understand the work of the Administration on Aging and the role that they play in helping our senior citizens to maintain their health and independence in their homes and communities. I thank you for watching and hope that you will continue to join us as we feature other federal agencies on your federal government.